Okay, let's get right to it. We're going to cut through all the noise and boil down first aid into the three most critical, life-saving skills that you absolutely positively need to know. The source material really hits the nail on the head here. This isn't some hypothetical what-if scenario that only happens in the movies. This is real life. It's a question of when you'll need this, not if. And that's really the big question, isn't it? When panic is screaming in your head, having a simple, clear plan can make all the difference. So that's what we're going to build today, starting with getting your head in the right space. So before we even get into the hands-on stuff, we have to talk about your mindset. It's all about understanding your role and what you're trying to achieve before you even lay a hand on someone. This is the foundation for everything else.
All right, so what are your goals? Well, they're called the 3 Ps, and they guide every single thing you do. First, and most importantly, preserve life. That's job number 1. Second, prevent the situation from getting any worse. And third, do what you can to help promote recovery. It's that simple, but so powerful.
So how do you actually do all that? You use the DRABC action plan. Just think of this as your mental checklist when you find someone who has collapsed. First, D is for danger. Is the area safe for you to enter? R is for response. Are they awake? A is for airway. Is it clear and open? And B is for breathing. This simple little sequence tells you exactly what problem you're dealing with.
So what happens if you get to that last step? Are they breathing? And the answer is no? Well, that brings us to our very first critical skill, CPR. We're going to focus on hands-only CPR because it's easy to learn, super effective, and something literally anyone can do.
Now this is so important, you guys. Forget all the complicated stuff you might have seen on TV. Modern first aid is laser-focused on one thing: high-quality chest compressions. When you do this, you are literally becoming that person's heart, pumping life-saving blood to their brain.
So how you do it right? It's these 4 things. Heel of your hand right in the center of the chest. Push fast. Yeah, to the beat of Staying Alive. Seriously, it works. Push deep, at least 2 inches. And this is crucial, let the chest come all the way back up after each push. That's what lets the heart fill back up with blood.
Okay, I want to stop on this for a second because this is what scares everyone. You might hear a crack. It's going to feel weird. But listen to what the guide says. A broken rib can be fixed. A brain that's been starved of oxygen for a few minutes, that can't. So please, whatever you do, don't stop pushing. All right, let's move on to our second critical skill. What to do when someone is choking. This is another one of those terrifying seconds-count emergencies where someone's air supply is just completely cut off. So before you do anything, you have to make a super fast assessment. Can they make any sound? If they're coughing, even weakly, or trying to talk, the airway is only partially blocked. Just encourage them to keep coughing. But if they are silent, if they can't make a sound, that's a complete blockage. That's when you have to act right now. This is the Heimlich maneuver. You're going to get right behind them, wrap your arms around their waist, make a fist, and put it right above their belly button. Then, grab that fist of your other hand and give sharp, hard pulls, both inward and upward. You're trying to use the air in their lungs to pop that object right out. Okay, our third and final skill is all about controlling severe bleeding. Someone can bleed to death in just a few minutes, so stopping that blood loss is just as important as breathing. The key here is one word: pressure. After you've called for help, your first job is to put firm, direct, continuous pressure right on top of that wound. Use a shirt, a cloth, whatever you've got. If the wound is on an arm or a leg, lift it up above their heart. Gravity will help you out. It's simple, but it works. But what about the absolute worst-case scenario? We're talking about an injury so bad that direct pressure isn't working and the bleeding just won't stop. What then? Well, there's one more tool you should know about. And that tool is a tourniquet. Look, let's be really clear about this. A tourniquet is a last resort. It's for when you have catastrophic bleeding from an arm or a leg that you just can't stop with pressure. This is a life-over-limb decision. This is so important that there are actual national campaigns, like Stop the Bleed, that provide free training to the public on how to use tourniquets. This is knowledge that could save so many lives in a major emergency. So let's pull all of this together. We've gone over the right mindset and the 3 core physical skills. You now have a blueprint for what to do in the scariest, most common emergencies. Now it's about making sure it sticks. So if you walk away with anything today, let it be this. Always start with DRABC. If there's no breathing, push hard and fast on the chest. If someone's choking and can't make a sound, abdominal thrusts. If there's severe bleeding, direct pressure. That's it. That's your life-saving toolkit.
And I have to end with this quote because it's so true. Beyond all the techniques and the skills, just remember this. Being the calm person in the storm, the one who takes control and offers reassurance, that is an incredible gift. That is also first aid.
Look, watching this gives you the knowledge, which is a fantastic first step. But to be truly ready, you need to feel these skills in your hands. You need muscle memory. Please find a certified first aid and CPR class near you and sign up. Practice this stuff, because when the time comes, you don't rise to the occasion. You fall back on your training. So I'll ask one last time. Will you know what to do?